Yeah, it probably just changed while you're trying to do that.
All right. So here we see Kara. Excuse me. Here we see Kara resting in a supine position with the real ease supporting her neck. She can lie like this on her own passively and get tremendous benefit. Sometimes we like to raise the knees to bolster, which takes a little pressure off the lumbar spine also, which aids in the benefit of the device. I recommend people lie in this position for starting out for 5 to 7 minutes on their own and just gradually build up. Oftentimes people will fall asleep or go into a meditative zazen type state, and that's perfectly fine. What's wonderful about this compared to many traction devices is there's no sense of confinement. If Kara wanted to roll to her side or sit up to pick up a phone or respond to a child's needs or someone else in her home, that'd be very easy to do because she would just sit up and there's nothing that's confining her. She's not hanging from a door the way a lot of traction devices work. So she has complete confidence that she's mobile if she needs to be. Okay. Now, what we can do with people, and this is uniquely beneficial, I believe also, is they can change the location of the device depending on where they're going to feel the most comfort. So we can bring it a little bit more away from her neck. And what this does is it gives a little bit different sense of which vertebrae is being a traction. It gives a little different relief sensation. We can also bring it quite close and just cradle the whole head. And this doesn't hit the spine here. It's very comfortable. There's plenty of room there. And you can see that in the indentation in our massage table here, that it's the weight of her head is compressing into this foam shell and allowing the traction to occur on her neck. Now, as a practitioner, one of the things we can do is increase the traction effect. I'm holding the device underneath and then gently holding along her forehead here, and I'm elongating. This is very subtle, gives a nice release, creates space between the discs, allows blood flow to increase into the neck and the muscles, and it's going to give a deeper sense of relaxation and more therapeutic benefit. Sometimes we can actually turn to the side a little bit. Still, the head feels very embraced and very comfortable. We can give a little bit of traction coming this way also. As a practitioner, the device feels really comfortable in my hand, and there's no problem at all. As an individual becomes more comfortable with the use of the Real-Ease, they often will fall asleep with it and then roll off it in the night. And that's fine because, again, it's a plastic shell. There's no sharp edges. It's not going to create any hardship. Now, a lot of times we put stress on our necks when we read in bed or watch TV in bed. A lot of times we're going to put our hand behind our head to give support to our neck. The Real-Ease really helps us, allows us to help read in bed or watch TV in bed with much more support. So what I'm going to do is just lift this up, and then she can come back. Now, depending on how high someone wants to be, we can use more pillows, or if you have a tilt bed, you can use that also. And this gives tremendous support, so she doesn't have to, she's not holding her head up at all here in order to accomplish the reading that she wants to do. She would just hold her book up, or if the TV is mounted, then she doesn't have to engage her muscles at all. And you can see these muscles are very soft, blood flowing through them really well, and she's quite comfortable. Okay. As a clinician, I can get people into this nice recumbent position here, and there's still plenty of room if I wanted to do acupuncture and needle the neck. That'd be no problem at all. And I'm already tractioning the neck, so we have that elongation of the muscles, increased blood flow into the muscles, and a deep, calming relaxation. Okay? So, whether you have neck pain or not, whether you like to read in bed or not, all of us can use a period where our necks feel more comfortable. where the weight of the world is off our shoulders. And this wonderful device, the Dr. Ryder's Realease, really accomplishes so much benefit for us for a very low price, very modest price, and can be used over and over again for years and years. One thing some people like to do is actually put a tissue here. If there's a problem with hair oils, you can use a gauze or a tissue here. It doesn't change the efficacy or benefit of the device. We just put it here, and we can use it like this. This is safe for children to use. It's safe for geriatric patients, elderly patients to use, people of all ages. It can be used with a pillow. You can fall asleep with it, or it could be used specifically for therapeutic interventions. Thank you very much.